How robotic technology transforms knee replacement surgery. 3D models of the patient's knee are generated using imaging technologies to plan the procedure with a high degree of accuracy. A robotic arm is used to perform the surgical actions with high precision, controlled by a computer system to make precise cuts on the bone that follows a pre-planned path based on the patient's specific anatomy. These precise cuts are essential for ensuring that the prosthetic components fit perfectly. The surgeon uses a console to operate the robotic system, making decisions and adjustments as needed. For advanced knee surgery options that combine expert care with cutting-edge precision, the precision of robotic assistance reduces the need for large incisions, leading to less tissue damage and a shorter hospital stay. Accurate placement and alignment through robotic technology enhance the durability of knee implants, potentially extending the life of the prosthetic.